I'm Mary Lou Campbell, and I have carpal tunnel, and I had surgery on it. And I'm certainly glad I did, because it's made all the difference in the world. I noticed that my hands were so numb and my fingers were numb, which didn't seem to bother me too much until the pain started. And the pain in my hands got where one weekend it was excruciating. And that made me know that I needed to see a doctor and find out what was what. And they ran a test where they shocked you with shocks to make sure that you had carpal tunnel. And after it was diagnosed that I did have the carpal tunnel, the surgery followed. And it was great because I never knew I had the surgery. And afterward, I took pain pills that night and the next 2 nights, but I never had any pain. I just took it to make sure I could sleep. And it was something that I would do again at any time, just to get rid of that numbness that wouldn't go away, and it would wake you up and it bothered you all day and all night.
This patient that we saw today, Ms. Campbell, is a fairly typical situation of carpal tunnel syndrome. She was having numbness and tingling in her fingers at night, and this would occasionally awaken her. It usually involves the thumb, index, and middle finger, and that's fairly typical for carpal tunnel syndrome. It doesn't necessarily have to be from computer use or a lot of repetitive activities, although that can add to the problem. But many times we see this in just regular activities of daily living that brings it on. We initially tried to treat the problem with splinting, wrist splints that you may have seen for carpal tunnel syndrome. Also, injections can be helpful. When those fail, then we recommend surgery, and Ms. Campbell had surgery for a carpal tunnel release. She also had a small ganglion cyst, which was sort of a different problem, but it was in a very close proximity to the carpal tunnel syndrome. So at the time of her surgery, we removed that cyst and fixed the carpal tunnel problem.
I was fortunate enough to have found Dr. French, who was great with my treatment, telling me what I had and setting up the surgery and doing the surgery. And it had to be a perfect surgery, because everyone told me the carpal tunnel surgery is so painful, and I never knew I had the surgery. So he's great.